Hi YouTube and welcome to my channel, Dr. Moniques Forum. Today we'll be starting off our breast series, where I'll be presenting on the breast, especially in relation to breast cancer. Now, breast cancer is the leading cause of mortality globally, meaning that it is the leading cause of deaths globally and also in Jamaica. In developing countries such as Jamaica, women tend to present with advanced breast cancer, meaning that at late stage breast cancer stages 3 or 4, or with metastasis, meaning that there is spread to other areas outside of the breast. And this really worsens survival outcomes. So we will kick off our breast series in discussing the anatomy of the breast. The breast is made up primarily of connective tissue, fat, and glandular tissue. This is a cross-section of the breast. On the outer aspect of the breast, there is skin, and then this aspect is the areola, which is a darker part of the breast that surrounds the nipple. The nipple is here. Let us start from inside out, right? So this is internally. If we do a cross-section, then these are the ribs. In front of the rib lies muscles. So specifically, this is a pectoralis muscle, but this is just muscle that overlies the rib. So this is the fatty component of the breast, which is the supporting substance of the breast stroma. And then there are also connective tissues in the breast. The breast anatomy in terms of composition will vary based on especially age, adolescence, early and later adult stages, and in the postmenopausal woman. So later on in life, postmenopausal, then you tend to have more fatty tissue than glandular tissue. These are the glands of the breast. And these round areas here specifically are lobules, which feed into what becomes the ducts. And these are developed mainly for especially reproductive purposes. So during pregnancy, milk is stored in the lobules, and then it is passed through the ducts to the nipple, and so the baby will breastfeed. Importantly, in terms of the anatomy, is what conditions will or can develop in different areas of the breast, right? So say, for example, if we're looking at majority of cancers develop in the ducts, about 75%, and about 15% will develop in the lobules. We now move on to just more of the same, just reinforcing the anatomy of the breast. So internally here, you'll have structures such as the lung. Here we have the ribs, overlying the ribs. Then you'll have, or in front of the ribs, you'll have muscle, which is a pectoralis muscle. And then there is a supporting stroma, which has of the breast, which is the fat composition. These are the glands which would store milk, and then it will be filtered down through the ducts, which basically will be excreted from the nipple. So if we're looking at the breast from front on view, you will notice that this is the nipple. This is the areola, the skin of the breast. And so this is a fatty component of the breast, and these are the glands. And when you look at a cross section of the glands, you will have the lobules feeding into the ducts, which feeds to the nipples, right? In addition to what we are seeing here, the cross section of the breast, there tends to be the breast here will have what we describe as the axillary tail of Spence, which goes onto the insert into the axilla. So the breast really lies on top of the chest and goes all the way, extends into the axilla or under the armpits, okay? This is a further look internally of the breast. So this is the breast, and these green structures will represent what we call the lymphatic drainage of the breast will be, which is very important if we're to understand how breast cancer spreads. So if the breast cancer develops in the breast and it spreads, it will spread majority of the time by the lymphatics. And most of the lymphatic drainage will go primarily to the axillary nodes, which are here. So these are the nodes under the armpits. And so as a part of your breast self-examination, is important not only to examine the breast itself, but also under the armpits to find out if there are any lumps. Next, we will look at a clinical application of the anatomy that we just viewed. What does this mean now? So this is the breast as a cross section. Here are the ribs, looking at the muscle, which is the pectoralis muscle, or the muscle directly on top of the chest. And we have here fatty tissues supporting the breast, connective tissues between glands, and the ducts, which feeds into the nipple. And here is the overlying areolar skin. Now, so you can have cancer, an example of a breast cancer. So this is a cancer that you can see here. And what does, in terms of a malignancy, or what does cancer mean? It means that it is no longer contained in the cells or the regular anatomy of the breast or of the structure being described. It invades, it basically breaches through surrounding walls of its respective cells. And as you can see here, it is feeding out and infiltrating and going into other structures or other areas, such as here. It is basically extending out of the glands and into the muscles or of the chest wall. Other anatomy, if you're looking here, may have cancer that is infiltrating the skin, and oftentimes it looks like what we describe as peau d'orange, which is the skin of the breast looking like orange peel because of infiltration of the breast, especially the lymphatics or the drainage under the skin of the breast itself. In terms of from the nipple, if you develop certain tumors inside of the duct, such as ductal papilloma, then those can have a high clinical presentation with blood being leaked from the breast. So you'll see basically nipple discharge, which is bloody. This here looks at cysts that can also develop in the breast. So these would be that you present with a lump, but it is not, this one is not cancerous. Also commonly presenting, especially in younger females, and would present almost like a lump that is mobile. They call it clinically being described as a breast mouse, but its correct name is a fibroadenoma. Can develop in the substance of the breast itself, but this is also non-malignant. It's a benign tumor. To recap, we did the anatomy of the breast, and we also looked at its clinical significance in terms of understanding what pathology, meaning that what kind of conditions can arise in the different areas of the breast. And understanding this anatomy will form a backdrop for the understanding as we move forward in covering other areas in our breast series, especially specifically in relation to breast cancer. Because breast cancer disproportionately affects developing nations such as Jamaica, it is very important to really try to close this gap. So understanding improvement in prevention, management, and control of breast cancer is therefore very important. Thank you for watching. Thank you. Please subscribe, share. See you next week for our next video in our breast series. risk factors of breast cancer.